Hello. So today we're going to talk about whether you should name your practice your name. Like mine is Allison Puryear, LCSW, CEDS, it gets long. Or if you should name it like a business name. So like my husband's is Ridgeline Psychiatry. So that gives you an opportunity to play with a few different options, and I'll go ahead and say neither one is right. Or I guess both are right. Neither one is wrong. Real quick, I want to thank Therapy Notes, though, for sponsoring the Ask Allisons. So some people can just like think of a business name and it fits for them and it works and it makes sense and they run with it. Some people delay opening their practice because they're having a hard time coming up with a business name. And that, in my mind, is a worst case scenario, because the longer you go without like opening up and getting started, the bigger a problem it's going to be to like get full, be able to get the show on the road, basically. So if you have a name in mind and you're super excited and it feels like a great fit, first vet it through your ideal clients. Like, do they care about that name? Make sure it's not, what's the word I'm looking for, trademarked or anything like that in your area or your state, and then go for it. I will say sometimes when it's a really good idea to have a business name rather than your name is if you plan to expand into a group practice or if you plan to sell your practice at some point. It's not a deal breaker. Like, you don't have to have a business name for those things, but it's something to consider. I will say in my experience, people remember my name more so than I think if I had a business name. Similarly, like I remember people's names but can't remember their business name. I think about my kid's pediatrician. I know her name, but it always takes me a second to remember the name of their practice. So I think sometimes, especially when you're networking and you're getting out there and you're building a reputation, your name can be a great asset as a business name. So I guess the take homes for this, don't force it. If you're racking your brain for a name that isn't cheesy and doesn't suck, then just go with your name. If you think of an amazing business name 2 months after you open, or 2 years after you open, or 20 years, you can do a DBA, which is doing business as. It's just a form you file with the government that says, my business started out with this name and now I'm doing business as this name. And again, no way is the right way or the wrong way. And if you do use your own name and decide to go into a group practice or create a group practice, then you can use "and associates" at the end. Boom, pretty easy. I hope that that's helpful. I'll talk to you later.